Hi friends, this is Dr. Abdequaem Chimthanawala. Today I'll be discussing the remedy SENEGA. We all know the importance of SENEGA in relation to cough symptoms, in relation to respiratory tract symptoms, in relation to its expectoration and cough. I'll tell you some symptoms of SENEGA in relation to mind and some symptoms of SENEGA in relation to cough, which you'll be able to differentiate SENEGA from other remedies. These symptoms have been seen in my practice many times. That's why I am sharing it with you. I had a case, a mother was telling about a child. सब चिड़चिड़ बहुत करता है, इतना चिड़चिड़ करता है लेकिन बोलता नहीं. लेकिन जब एक बार बोलता है इतना जम से चिल्लाता है, इतना जम से चिल्लाता, हम सब घबरा जाते हैं. This was the Hindi version of what the patient's mother told about the child. Irritable, and one time that irritable outburst comes out. That was it. And I tried a lot of remedies, it did not work, but I gave the patient SENEGA. When I heard one symptom, I read one symptom in SENEGA, irritability outburst off, and SENEGA treated that case very well. There's one more symptom of SENEGA in relation to mind that you must remember, that is anxiety in the chest. The patient feels very anxious in the chest. There are a lot of remedies who have anxiety of chest. SENEGA has a typical symptom, anxiety in relation to chest, and motion ameliorates. So when the patient walks, the patient talks, the motion, whenever he is in motion, he feels much better. That's again a very interesting symptom of SENEGA. In fact, I had a case of cough and he had this symptom, so I confirmed that symptom in SENEGA. Next, the most important symptom of SENEGA cough is rattling. Rattling respiration, loose, it's like a lot of cough in the chest. Whenever you have rattling respiration, whenever you have cough in the chest, normally we think about remedies like antimtat or other remedies, SENEGA, antimtat, but SENEGA is a very, very important remedy for rattling cough. Calicarb is there, phosphorus is there, calcarea is there, but SENEGA again is a very, very important remedy, rattling loose cough. And the patient will come typically and tell you, when he coughs, there is thick, tough, ropy mucus. Very ropy and tough mucus. Don't always think about calibacrum. It is there in calibacrum, but in SENEGA, tough, ropy mucus, you can say vomiting of ropy mucus. The patient has to take out mucus like this from the throat, or he'll take the handkerchief and wipe the mucus. It is so tough, and he has to vomit out so that everything comes out, because it's a rattling loose cough. One more very particular, a very interesting symptom, a peculiar symptom of SENEGA is the patient says, whenever I sit to eat, whenever I start eating, the cough starts. So I have to leave my plate. मतलब जब भी मैं खाना शुरू करता हूँ, मेरी खांसी शुरू हो जाती है. This is again a very, very important symptom of SENEGA. I had few cases of SENEGA, where the patient had a very typical, expectoration. Ropy is there, that is SENEGA, but expectoration taste. The patient is बहुत गंदी बास आती है डॉक्टर साहब. हो सकता है कल मैं बाहर गया था ना बाथरूम में, तो वो यूरिन की बास मेरे दिमाग में रह गई, इसलिए यूरिन के समान मुझे खांसी आ रही है. Expectoration tastes like urine. So it is not that when you went to the bathroom next day, yesterday, and now the urine, the cough is like urine type taste, but it is a SENEGA symptom where expectoration tastes like urine. You have to compare this symptom with other two drugs, graphitis and phosphorus, but SENEGA comes first whenever I have seen in my practice. So these are very few clinical symptom of SENEGA which I have seen in my practice, and you can differentiate SENEGA from other remedies like rattling loose cough, cough and beginning to eat, cough, ropy, tertian, mucus, vomiting, taste, expectoration, urine like, anxiety of chest, better by motion, and irritability outburst off. So these are very few symptoms of SENEGA. I hope you also gain something from this video, and if you like this video, do share and subscribe. Thank you.